Hello everyone, it's Helen here with Helping Up with Helen. Thanks for joining me. Today's video we should call Double Trouble because that is exactly what it sounds like. I have been dealing with my own tooth trauma, and if you are watching this video, then you might be experiencing your own tooth trauma. So I am happy to have you here because I'm going to be going over a couple of things that may be of importance to you because I have been dealing with something for the last couple of months and it has been zero fun. And so bear with me. I only want to make this video one time, so I'm just going to spitball my way through it. Hopefully you get all the information you need, and if not, throw some comments in the comment section. But I have been going through the ringer. I have been dealing with tooth number 29 and I've been dealing with tooth number 19. And so as we know, 19 and 29, those are molars and those are our chewing teeth. So those teeth take a hit. Mine have been taking a hit since I was a kid, since I was eating Jolly Ranchers, hot tamales, gummy bears. And so those teeth had fillings in them probably when I was in elementary school. It didn't get better after that, I can tell you, because I've had to have root canals in them. Number 19 has had a double root canal, which ended up failing just recently. Over here, we've got 29. 29 had fillings. It had a root canal. Ultimately, it ended up getting pulled. I had a bridge in there for years, and then I ended up getting a dental implant that was there for 18 years, and ultimately that ended up getting infected recently, and I had to get that removed. And so we're going to talk about that today and that process and what it looks like and what happened. And so let's start with tooth number 29. Let's just go to the dental implant. Okay, I mentioned that I had a bridge in there. I loved my bridge. I never ever had any problems with my dental bridge. As long as you flossed underneath of it, you kept it really clean, I had never had a problem with it. Now with a bridge, you usually have to obviously attach it to the tooth in the front and then the tooth in the back. And so you have to have really strong, healthy teeth typically to be able to put a bridge in your mouth. Well, about 18 years ago, I was going to a dentist then, and he was always like into the latest and greatest of everything. And he thought that I would be a really, really good candidate for a dental implant. So he suggested it to me, and then he brought it up again and again. And ultimately, I ended up caving at that point, even though I wasn't really sure that I wanted to get a dental implant. For a couple of reasons. One, because I had a perfectly good bridge right there that didn't need to be messed with. And then two, the dental implant was going to take a lot of time. So if you haven't had a dental implant, you need to realize that you are going to be needing to take some time for this tooth. Ultimately, it can go up to about 9 months to a year even, depending. So it really just depends on your dentist, what you're having done, but it's not something that is just overnight. So just be prepared for that. And you also have to know that if you are going to get a dental implant, it is unbelievably expensive. So insurance will maybe cover a little bit. I don't really know what your insurance covers. Everybody's is different. But I know that when I got mine 18 years ago, it was almost $6,000 for the process for one tooth. Now, I'm not against dental implants. I know a lot of people have them. A lot of people love them. My dental implant, however, when I ended up getting it, it actually caused me some problems for the first couple of years. It was uncomfortable. I didn't like to chew back there. For me, it just wasn't a good fit. In fact, my dentist ended up calling me at the time because he was trying to get other people to get dental implants, and he wanted me to kind of be like a spokesperson to talk about getting dental implants, and I wouldn't do it because my experience wasn't great. And I'm like, I don't want to lie to these people because I wasn't happy with mine at the time. Now, we already know it ended up giving me 18 solid years. So obviously it got better. And so that was a good thing. However, nobody ever prepared me for the fact that my dental implant could fail. I would have never dreamt that in a million years. Nobody's ever mentioned it. I haven't talked to anybody who had dealt with that. And so a couple of months ago, though, I really started to notice actually over this past year that food was starting to get more lodged, on the sides of it. And so I was just like, what is changing here? Ultimately, now I know it was bone loss. Like everything was kind of changing. My gums were kind of receding a little bit. I was getting more bone loss in that area. So food was starting to get kind of lodged up in there. And usually you could just fish it out. I know this is gross, but you just get your little threaders or you get your little flossers and you can just get it out, and you just make sure to keep it really clean back there. I never really had a problem with that. I just noticed that it was starting to become more problematic. And so over the last couple months, though, I noticed that even my little flossers weren't really getting it out. And I was starting to get little thick pockets where it looked like it was getting puffy and it looked like it was maybe getting infected. Lo and behold, I ended up getting a really good infection back there. In fact, it wasn't painful. It was more of like a sting. And I noticed, I was like, ooh, it's really puffy back here. I went into the bathroom and kind of pressed on it, and there was just pus, there was blood, it was a whole thing. And I'm like, oh wow, this is really infected back here. And I didn't really realize it. So I'm like, oh no. And if you guys watch any of my other videos, you already know that anytime I have an infection, I kind of borderline panic, just because I'm not somebody who can really take antibiotics comfortably because of all of my gastroparesis issues and my GERD issues. And so I have a lot of GI issues. And so I am not a good candidate for antibiotics. So usually if I'm going to take them, it has to be very, very, very short term, or it has to be through a drip IV. And so already I'm like, oh no. So what I started to do is I ended up just doing saltwater rinses, because I thought, okay, let's just try to clear up this little baby infection with some salt water. Maybe I just need a good floss in there. Maybe there's some food stuck in there. That's what I was thinking. I bought one of those water pick things off of Amazon. I think it was $100, and it was a good thing. I mean, you can kind of spray the water in there and kind of clean it up. But I just noticed that wasn't it wasn't going away. And so I'm in a new state. I don't know where to go. I don't know what to do. And so I find a dentist. I go in, I visit with him, and I'm just like, hey, I have this implant over here and it's infected. And so he takes every x-ray known to man. You guys, I mean, this office, wow. I'm like, who would have thought? The technology nowadays, I'm like, what is happening here? I mean, they could see everything in this mouth. And so I'm like, you know what? While we're in here, we're probably going to look at a couple other teeth that I'm having issues with as well, because as I had been babying number 29 because of the infection, I was chewing on tooth number 19, which, you guys, this tooth over here is another story, because I've had a root canal in it. And then I had to have a retreat. So if you don't know what a retreat is, it's another root canal in it. And I already know this tooth has been hanging on by a thread for years, to the point where you don't want to chew over here. You don't want the dentist to really touch it. You don't really want it to be cleaned around, because we already know, my dentist and I, it's we don't want to poke the bear. So we've all been watching this tooth for years, which is crazy, because if you even tried to floss around it, it would bleed. There was always a dull throb. So I was never really chewing on it. But now that we have an infected tooth, I had to start chewing on here a little more. So I started to notice, I'm like, ooh, it's not feeling good. This tooth over here is starting to throb. Things aren't good. If you've had a double root canal, the chances of that tooth being a survivor, it goes down big time. Let's just put it that way. I was a dental assistant for a few years for an endodontist that is a root canal specialist. And so I learned that it's you might be able to save that tooth with a double root canal, but if you're still having pain after that and discomfort, and it's still not good to chew on and floss around, more than likely that tooth probably has a crack in it and it's not going to make it. And ultimately you're going to have to get it pulled, get an implant, or get a bridge or something. And so already this tooth is throbbing. The dentist does all of the x-rays, and then he comes back to tell me, and he was just like, yep, it looks like you have peri-implantitis over here. And I'm like, what? What is peri-implantitis? Okay, guys, look it up. And when you do, you're going to be like, what is it? What? There's nothing good about peri-implantitis. Okay. Nothing. It goes from bad to worse. So you're like, what am I supposed to do here? I have this dental implant, this post that's in my jawbone that's been there for 18 years. I'm like, what are we going to do about this? And he was just like, yeah. And he's like, you know what, kid? He called me kiddo. He's like, you know what, kiddo, I'd rather chew my arm off than send you out of here, but you're going to have to go to a specialist and figure out what you're going to do about that. And he goes, because they're probably going to have to break that post out of the jawbone, and they're going to need to, do some bone grafting. And I'm like, what? And then they're like, and ultimately you're going to have to get a new dental implant. And you guys, that was like the absolute last thing I wanted to hear, because one, I don't have any money and the time and the pain involved. And I'm like, what in the world? And so I'm like, okay. And so then he says, and then on this side, he's like, you probably need to go see an endodontist, he said, because I think you probably have a crack, but you might see about getting it retreated again. And I'm like thinking to myself, like, I am absolutely not going to get this tooth retreated for a third time, because we already know that root canals are expensive as well. And if we've already done it twice and it's no bueno, it's not getting any better. So again, though, I'm stressing because I'm like, oh no, I'm going to have to pull this tooth and potentially get an implant, which I don't want, or a bridge, which I would rather have. However, they informed me right there in the chair, like, you're probably not a good candidate for a bridge over there, though, because you've had too much restoration on the tooth behind it, and then you've had too much work on the tooth in front. So it wouldn't probably be beneficial for you to get a bridge. So guys, the only thing that I can possibly even be looking at is another dental implant. And so I was like a little bit taken back because I was just overwhelmed by all the news. Not to mention, he's just like, you got an infection. I need to put you on some antibiotics. And dentists aren't the ones who are going to be like, yeah, go get a drip IV. Your general doctor, will usually help you with that, especially if you're somebody who has underlying stuff like I do. But the dentist that doesn't know me, he was just like, the best I can do is give you a liquid form, like amoxicillin, take it for a couple weeks and, take care. And so I left and I was like, oh no, I don't know what to do. He gave me a couple referrals. Ultimately, I ended up going to an oral surgeon. Same thing, had to get a bunch more x-rays, only for him to tell me, yes, we're going to have to get that post out of your jaw. You're going to need to get a lot of bone grafting over here. He's like, we got to stuff it. He's like, you've had a lot of bone loss. He's like, ultimately, we're going to have to pull this one out over here too. You're going to have to get some bone grafting done there as well. We need to prep that one for a dental implant. And he said it looks like this one is infected as well right now. And so now I have double trouble. I have infections on both sides that I'm trying to deal with. And he was just like, so let's get you scheduled up for surgery. Oh my goodness, you guys, I am telling you what, I ended up going in and I ended up getting the surgery. So yes, I did have the surgery. I had to get this one removed. I ended up having to get this one removed. This was a month ago, guys. So keep in mind the swelling is mostly down at this point. My cheeks were like chipmunks. And I can tell you with that bone grafting, having to get the implant taken out of this one and having to pull a big molar back here, it was so unbelievably painful. This one over here was so excruciating. Like literally I would be sitting there like crying, and I feel like I have a pretty high pain tolerance. I mean, I've had lots of dental work done, I've had surgeries, I've had different things, but we all know that tooth pain is like a different kind of pain. It was so unbelievably painful for the first 2 weeks that I can't even tell you. It was just like, oh my goodness. I mean, it was just throbbing. I was so bruised. I had yellow bruising going up and down my neck, on my face. I mean, it was like a whole thing. You would have thought that I was in a boxing match. It was horrible. Like I was sending people pictures and they were like, Helen, I don't even recognize you. Like it was that bad. And I don't want to scare anybody. I'm just being completely honest about my experience. But I also want you guys to keep this in mind as well if you are looking at having to get your implant removed and getting your molar removed and getting bone grafting done. You guys, for me personally, I can't take a lot of the medication for pain that a lot of people can just because of a lot of my stomach issues. Like I'm good to go maybe for a few days on Tylenol, and then it starts to just wreck me in a whole different way. And obviously, if you're somebody who has these procedures, you hopefully are somebody who can take the medication that they prescribe to you. You can take the ibuprofen. They give you a prescription kind that will keep some of the swelling down. They'll give you prescription, a little higher than Tylenol, more than likely, that will help you with your pain. So if you're somebody who tolerates that well, you should be probably okay. I can't really take anything just because of my stomach and just because of how sensitive I am. So I literally, and I had just done a few weeks of antibiotics, which wrecked me. So already my stomach was not having it. So ultimately I could just do Tylenol, and I had to do ice and heat for 2 weeks. And it was just nonstop because of the pain and trying to get the swelling down. And then the heat would make it feel a little bit better. But you guys, it really for me was a serious deal. But I can tell you now, it's been a month and I'm doing so much better. In fact, I just had my follow-up appointment and they took out the remaining stitches. So we got out all the stitches, and those were kind of a pain too. So just be prepared for that, because they're just sitting in there and it's just, ugh. But we did get the stitches out. They asked about my pain level, and I told them that now, I mean, it was like an 8. It was so bad. I said, but now I'm like, oh, it's like a 1. And really now it's just more of like a dull ache on both sides, because your bone is trying to adjust to the new bone grafting that's still in there. This side over here, though, doesn't seem to be taking like this side, and we're just not exactly sure what's going to happen with this side over here, because he's like, ooh, it looks like we might have lost some of the bone grafting already up top. We're going to just have to look at it here in a couple months and just see how it's healing, because this side right here I still can't chew on. It's very sensitive. It still burns. I'm still having to do salt water rinses. I'm still having to put a little hydroperoxide on there with like a Q-tip, and so it's still very sensitive. It's still needing a lot of TLC, and so we're just not exactly sure how my body is responding to the bone grafting on this side. But this side was still infected while I had the surgery, and so I'm not exactly sure. That was one of my concerns, and I did bring it up to the surgeon. I said, hey, is it normal or safe to be able to still get that bone grafting in here the day that we pull it, with there being like active infection in there? And they felt like it would be okay, just because they were going to clean it out, do a triple rinse. They were going to give me a little bit of a drip IV while I was under, because they had me under during this procedure. And you guys, it was a couple hour procedure almost for them to do both sides of my mouth. So I was actually under for a while for this procedure. And so but they felt like it was a good idea to be able to do that. However, like I said, right now, I'm still having some issues with it. He did ask me, he's like, did you swallow a big clump of something at any point? I was like, no, not that I know of. But I still am getting speckles of the bone coming out. Like you'll find like little salt pebbles that just kind of come out, just push out and stuff, which is really normal. So that would be nothing that you would be concerned about, because that's completely normal. Your dentist will tell you that. But yes, heat, ice, your medications, all of that is going to be your absolute best friend. And then obviously easing into diet. My oral surgeon said, relatively fast, like go into eating normal, just eat what you can, eat pretty normal and stuff. But I would say kind of soup it and kind of do all that as much as you can. I think I might have tried to jump in a little too fast, which I like in hindsight, I'm like, no, I feel like I still needed to baby it, even though my paperwork was kind of like, no, you're good, And so that would just be my own suggestion. In fact, I'm to the point now, being a month out, where I'm still having like this healing sensitivity, where I'm like, okay, I think I need to kind of go back to just eating the soft eggs and going back to, doing yogurt and going, back to just kind of like the light soups and kind of get away from some of the meats, definitely crunchy stuff, anything that's going to irritate the gums, because, I've kind of been there, done that a little bit over the month, because, I was starving. But now I'm like, I think there still needs to be some healing done in there. And so, okay, guys, stitches are out. Bone grafting's hopefully going to take. This side's doing really good where the implant was, and that was the sore side to begin with. And now we got to wait. Now it's a waiting game. So he says, I will see you in a couple of months, because it's already been a month. So at the 3-month mark, they'll see me. They're going to take x-rays. We're going to see where I'm at. And then they're going to see if we're ready to start getting ready to set the posts. And so then what will happen again is you are going to have to go nighty-night, and then they're going to go in and they're going to set those posts in there. And then we're going to have to wait another 3, 4, 5 months, however long, until those new posts take, and make sure that the bone is strong and coming around it. Sounds like they're going to put more bone grafting in there when they do that. And then at that point, then you go back to your general dentist, and then they will put the little abutments on, like the little teeth, the new teeth, and then you should be good to go. But you guys, this will probably be like November, December before everything is all said and done. Maybe even a little bit later than that, just depending on how things are healing up with all of this bone grafting stuff. And so I can tell you, though, that the whole cost is going to be about $10,000 when everything is said and done, out of pocket. That's out of pocket. because of all the bone grafting and the surgeries and the new implants. And so my insurance is going to be covering a chunk, because what it does, it goes through like stages and phases and all those things. But it's going to be close to $10,000 for everything. And so it's not cheap. And you're just like, wow, like for 2 teeth. That to me just seems a little crazy. Not to mention these are 2 teeth that have already had double root canals, already spent $6,000 on this tooth for an implant. And that is a little bit of one of my fears with this. And I really genuinely, one, got to pray about it first and foremost. And I really want to do a little research, and I want to talk to my dentist and Casper about it when I'm back visiting home, because I want to talk about, like, you know, with the fact that I already had peri-implantitis on this side, and had a failed, you know, implant, what are my chances of that happening again on both sides? Obviously with age and hormones and how our gums change and just how everything in the body changes, you know, edging toward 50, you know, your body changes. And now already having like a failed one, like what are my chances of having that happen again? Because that would be horrible to have that happen again, to go through all of this, have implants placed, and then for them to be like, nope, they didn't take, you have peri-implantitis, you know, the bone grafting didn't work, you know, like we had hoped, and then to go through all this, ultimately just to end up having to, you know, do something completely different back there, like flippers or, you know, those little things they have, they just pop in. I don't know. I kind of half jokingly was talking to them, and I was just like, hey, you know, maybe it's time to just do it all. And they're like, no, absolutely not. Like they wouldn't hear of it. And I was more or less kidding, but I'm like, I know a lot of people, you know, who got to the place where they had to have, like, you know, their teeth removed, and they have really healthy, like now they're doing well. Okay. Their smiles are gorgeous. They're white. They're straight. I know they're like, so many people are like, no, I know some people and it's horrible and it changes the way they smile or the way they chew. And I know there's all those stories as well, but I know people who actually have like dentures and stuff, who have beautiful smiles, who eat a relatively normal diet and have had them for years and years, and they do great with them. So I really think, again, it depends on who does it, quality, making sure that you're getting them fitted. There's all sorts of stuff. So, I mean, obviously there's worst case scenarios as well. The ones that fall out, they don't fit, they're too big for your mouth, they're uncomfortable, you can't chew. I get it. So, I mean, again, you'd have to have a really qualified dentist, make sure that you get a lot of fittings and find what's best for you. But I know people who have full sets of dentures who do amazing, who look amazing. And I'm like, you know, it could go either way. But anyways, I'm not getting full sets of dentures. Okay. At least not today. But I mean, honestly, truly, I mean, how many $5,000-$6,000 teeth can you continue to put in your mouth and afford, right? Okay. There's going to hit a point. So everything is caught up with me. First and foremost, I'm going to say it's the candy. Okay. I know it is, from the kids, all my kid candy. It caught up with me, and here we are. So, but hopefully all of this just gets taken care of and we can move forward. I'm not looking forward to this though in the future. Like if I can swing it, like if I start having any issues up top, I don't know about you, but honestly, truly, I think I would just try to get a bridge. Like I'm a bridge girl, but everybody else seems to like those implants. So you tell me, leave it in the comment section. Anyways, hopefully you're doing okay. If you're watching this video and you are having to go and experience any of this, throw it in the comment section. I will give you my own honest opinion. Obviously, we're so different. Our experiences are so different, and this is just my experience, but I would love to answer any questions that I possibly can about the procedure, or about my peri-implantitis, or about my my double-filled root canal, if I possibly can for you. So God bless, have a good day, and thanks for watching.